you can see the location, the image of this Mayo Clinic. Where is the Mayo Clinic? Mayo Clinic is in USA. If you go to Google, this is the Mayo Clinic. This is the locations of Mayo Clinic. You can see Mayo Clinic is known around the world for top quality health care and cutting edge research with major campuses in Arizona, Florida, and Minnesota. Mayo Clinic patient and visitor guide, you have got it. Buildings and maps, patient and visitor guide. Mayo Clinic in Florida, Mayo Clinic in Minnesota. You will also get support getting to Mayo Clinic's main campus, international locations, Mayo Clinic Healthcare London, United Kingdom, Mayo Clinic Healthcare System. Visit our website, you can also donate to the Mayo Clinic. There are many other things also, and you will get all the information of disease from the website of Mayo Clinic. Mayo Clinic has also some students for undergraduate and graduate courses. So this is the website of Mayo Clinic. If you go to Google, if you search any medicine, you will get lot of informations about this Mayo Clinic. Solving the world's toughest medical problems one person at a time. Transforming healthcare, who we are. Mayo Clinic is telling that who we are. Mayo Clinic is the largest integrated non-profit, not-for-profit medical group practice in the world. We are building the future, one where the best possible care is available to everyone and more people can heal at home. Our relentless research turns into earlier diagnosis and new cures. That's how we inspire hope in those who need most. Mayo Clinic wants building a healthier world. We think big and act boldly to improve the health of communities and accelerate equality and diversity in healthcare. They are also focused on improving health quality, health disparities, commitment against racism. That means there is no racism here. They also like to reduce greenhouse gas and people who make the difference. Everyone at Mayo Clinic is on a mission to provide compassionate, world-class care to each person in every connection. That includes 1.3 million patients from over 130 countries who visit Mayo Clinic campuses each year. We also train future health leaders who share our drive to transform healthcare. A diverse staff makes every single aspect of our organizations better. At Mayo Clinic, we work to create the right environment for our staff to thrive, feel valued, enjoy their work, and provide an unparalleled patient experience. Discover more about Mayo Clinic locations, campuses in Minnesota, Arizona, and Florida, a network of regional clinics and hospitals and international locations. Governance and Board of Trustees, medical accountable care, volunteers, Mayo Clinic networks. So this is the website of Mayo Clinic. You can see request appointment, disease and conditions, find a doctor, donate, care at Mayo Clinic, health library for medical professionals, research and education at Mayo Clinic, giving to a Mayo Clinic, transforming healthcare. Mayo Clinic is the largest integrated not-for-profit medical group practice in the world. So let's try to health library, disease and conditions. Diseases and conditions, symptoms checker, clinical trials, connect to support groups, learn about Mayo Clinic, find a doctor, explore careers, sign up for free, about Mayo Clinic, about this site, contact us, location, health information policy, media request, and you will get health library. If you go to health library, let's see what happens, what's in the health library. Disease and conditions, test and procedure, drug supplement for medical professionals, giving to Mayo Clinic. There are many things in this website, but I cannot find the exact. Find disease and conditions by first letter. Say H. Disease. Pylori, HO, HA, hair loss, hamster, HB, infection, HC, head and neck cancer, headache, migraine, cluster headache, sex headache, sinus headache, spinal headache, heart arrhythmia, heart attack, heart disease, heart failure, heart murmurs, herbal disease, heartburn, heart exhaustion, heat stroke, heavy menstrual bleeding. Okay, now we will just read about heart failure from the just I am just showing you what things are every information about heart is stored. Every information about health. Everything is all types of diseases are recorded in the website of Mayo Clinic, and the videos that I make on health related, I always try to collect the information from the website of Mayo Clinic, and I personally believe, and the videos I have seen, I have gone through the websites, and I think this really helps us. So now let us read about heart failure from the website Mayo Clinic. Besides this, behind the foundation of the Mayo Clinic, there is also a history how this clinic was established. But today I don't like to go on to that topic, but just I would like to share you a page on heart failure from the Mayo Clinic website. Overview. Heart failure occurs when the heart muscle doesn't pump blood as well as it should. I am doing this video just to give you some information that you can collect from an authentic Mayo Clinic website. So when this happens, blood often backs up and fluid can build up in the lungs, causing shortness of breath. Certain heart conditions gradually leave the heart too weak or stiff to fill and pump blood properly. So 7 people are only watching. I cannot see in my mobile phone, but in the laptop I can see that 7 people are watching. Oh, now 10 people are watching. So this is I think one of the best and reliable source on medicine, on medical science problems, on how to deal with the patients, on how to get new information from any kind of medicines. So now let's go back to to read from the website of Mayo Clinic. Certain heart conditions gradually leave the heart too weak or stiff to fill and pump blood properly. These conditions include narrowed arteries in the heart and high blood pressure. Um, Proper treatment may improve the symptoms of heart failure and may help improve the symptoms of heart failure and may help some people live longer. Lifestyle changes can improve quality of life. Try to lose weight, exercise, use less salt, and manage stress. But heart failure can be life-threatening, as you can see in the website of Mayo Clinic. People with heart failure may have severe symptoms. Some may need a heart transplant or a device to help the heart pump blood. Heart failure is sometimes called congestive heart failure. So now you can see here the symptoms of heart failure. Now let's enlarge the image. In this picture, you can see the normal heart and the enlarged heart. When you have an enlarged heart, this heart failure occurs when the heart muscle doesn't pump blood as well as it should. Blood often backs up and causes the fluid to build up in the lungs and in the legs. The fluid buildup can cause shortness of breath and swelling of the legs and feet. Poor blood flow may cause the skin to appear blue or gray, depending on your skin color. These color changes may be harder or easier to see. So, these types of heart failure can lead to an okay. So, if you have heart failure, your heart can't supply enough blood to meet your body's needs. Symptoms may develop slowly. Sometimes heart failure symptoms start suddenly, and uh, heart failure symptoms may include shortness of breath with activity or when lying down, fatigue and weakness, swelling in the legs, ankles, and feet, rapid or irregular heartbeat, reduced ability to exercise, wheezing, a cough that doesn't go away, or a cough that brings up white or pink mucus with spots of blood, swelling of the belly area, very rapid weight gain from fluid buildup, nausea and lack of appetite, difficulty concentrating or decreased alertness, chest pain if heart failure is caused by a heart attack. When to see a doctor? You will get lot of information from the website of Mayo Clinic. So I am just showing you as a sign that you will get many informations, much more information from Mayo Clinic. So when to see a doctor? See your healthcare provider if you think you might have symptoms of heart failure. Call 911. That means if you live in the states, or emergency medical help if you have any of the following. If you have chest pain, if you have fainting or severe weakness, if you have rapid or irregular heartbeat with a shortness of breath, chest pain or fainting, uh, um, if you have sudden severe shortness of breath and coughing up white or pink or foamy mucus, these symptoms may be due to heart failure, but there are many more possible causes. Don't try to diagnose yourself. At the emergency room, healthcare providers do tests to learn if your symptoms are due to heart failure or something else. Call your healthcare provider right away if you have heart failure and your symptoms suddenly become worse. You develop a new symptom, you gain 5 pounds or 2.3 kilograms of more within a few days. Such changes could mean that existing heart failure is getting worse or that treatment is not working. So, what are the causes of heart failure? You will get all information about any sort of disease. What are the causes of chambers and valves of the heart, enlarged heart in heart failure? Heart failure can be caused by a weakened, damaged, or stiff heart. If the heart is damaged or weakened, the heart chambers may stress and get bigger. The heart can't pump out the needed amount of blood. If the main pumping chambers of the heart, called the ventricles, are stiff, they can't fill with enough blood between beats. The heart muscle can be damaged by certain infections, heavy alcohol use, illegal drug use, and some chemotherapy medicines. Your genes also can play a role. Any of the following conditions also can damage or weaken the heart and cause heart failure: coronary artery disease and heart attack. Coronary artery disease is the most common cause of heart failure. The disease results from the buildup of fatty deposits in the arteries. The deposits narrow the arteries. This reduces blood flow and can lead to heart attack. A heart attack occurs suddenly when an artery feeding the heart becomes completely blocked. Damage to the heart muscle from a heart attack may mean that the heart can no longer pump as well as it should. High blood pressure, also called hypertension, this condition forces the heart to work harder than it should to pump blood through the body. Over time, the extra work can make the heart muscle too stiff or too weak to properly pump blood. Heart valve disease. Only 9 people are still watching. I am reading from Mayo Clinic, one of the reliable sources about health information and the health disorders or psychiatric disorders or anything that you need about health. You can go and you can browse the website of Mayo Clinic. Heart valve disease. The valves of the heart keep blood flowing in the right way. If a valve is not working properly, the heart must work harder to pump blood. This can weaken the heart over time. Treating some types of heart valve problems may reverse heart failure. Inflammation of the heart muscle called myocarditis. Myocarditis is most commonly caused by a virus, including the COVID-19 virus, and can lead to left-sided heart failure. A heart problem that you were born with, also called a congenital heart defect. If the heart and its chambers or valves haven't formed correctly, the other parts of the valve have to work harder to pump blood. This may lead to heart failure. Irregular heart rhythms called arrhythmias. Irregular heart rhythms may cause the heart to beat too fast, creating extra work for the heart. A slow heartbeat may also lead to heart failure. Treating an irregular heart rhythm may reverse heart failure in some people. Other diseases. Some long-term diseases may contribute to chronic heart failure. Examples are diabetes, HIV infection, an overactive or underactive thyroid, or a buildup of iron or protein. Causes of sudden heart failure also include allergic reactions, any illness that affects the whole body, blood clots in the lungs, severe infections, use of certain medicines, viruses that attack the heart. Heart failure usually begins with the lower left heart chamber called the left ventricle. This is the heart's main pumping chamber. But heart failure also can affect the right side, the lower right heart chamber is called the right ventricle. Sometimes heart failure affects both sides of the heart. Types of heart failure. Right-sided heart failure description is this type affects the lower right heart chamber called the right ventricle. Fluid may back up into the belly, legs, foot, causing swelling. Heart failure, left-sided heart failure. The description is this type affects the lower heart chamber called the left ventricle. Fluid may back up to the lungs, causing shortness of breath. Heart failure with reduced ejection fraction or SFREF, also called systolic heart failure. This is a type of left-sided heart failure. The left ventricle Mm, the left ventricle can't squeeze as strong as it should. The heart is not strong enough to pump enough blood to the body. Heart failure with preserved ejection fraction HFpEF, also called diastolic heart failure. The description is this is a type of left-sided heart failure. The left ventricle can't relax or fill fully. The heart has a problem filling with blood. Source American Heart Association or AHA. Risk factors. So, what are the risk factors about heart failure? How you can guess that you may have an impending heart failure? The diseases and conditions that increase the risk of heart failure include coronary artery disease. Narrowed arteries may limit the heart's supply of oxygen-rich blood, resulting in weakened heart muscle. Heart attack. A heart attack is a form of coronary artery disease that occurs suddenly. Damage to the heart muscle from a heart attack may mean the heart can no longer pump as well as it should. Heart valve disease. Having a heart valve that doesn't work properly raises the risk of heart failure. High blood pressure. The heart works harder than it has to when blood pressure is high. Irregular heartbeats, especially if they are very frequent and fast, can weaken the heart muscle and cause heart failure. Congenital heart disease. Some people who develop heart failure are born with problems that affect the structure or function of their heart. Diabetes. Having diabetes increases the risk of high blood pressure and coronary artery disease. Sleep apnea. This inability to breathe properly during sleep results in low blood oxygen levels and an increased risk of irregular heartbeats. Both of these problems can weaken the heart. Obesity. People who have obesity have a higher risk of developing heart failure. Viral infections. Some viral infections can damage to the heart muscle. Medicines that may increase the risk of heart failure include some diabetes medicines. The diabetes drugs Rossi, rosiglitazone and proglitazone have been found to increase the risk of heart failure in some people. Don't stop taking these medicines without first talking to your healthcare provider. Some other medicines that may lead to heart failure or heart problems include NSAIDs or non-steroidal anti-inflammatory drugs, and some medicines used to treat high blood pressure, cancer, blood conditions, irregular heartbeats, nervous system disease, mental health conditions, lung and urinary problems, and infections. Other risk factors for heart failure include aging. The heart's ability to work decreases with age, even in healthy people. Alcohol use. Drinking too much alcohol may weaken the heart muscle and lead to heart failure. Smoking or using tobacco. If you smoke, quit. Using tobacco increases the risk of heart disease and heart failure. Now let's talk about complications from the website of Mayo Clinic. If you have health failure, it's important. If you have health failure, it's important to have regular health checkups. Even if symptoms improve, your healthcare provider can examine you and run tests to check for complications. Complications of a heart failure depend on your age, overall health, and the severity of heart disease. They may include kidney damage or kidney failure. Heart failure can reduce the blood flow to the kidneys. Untreated, this can cause kidney failure. Kidney damage from heart failure can require dialysis for treatment. Other heart problems. Heart failure can cause changes in the heart size and function. These changes may damage heart valves and cause irregular heartbeats. Liver damage. Heart failure can cause fluid buildup that puts too much pressure on the liver. This fluid backup can lead to a scarring, which makes it more difficult for the liver to work properly. Sudden cardiac death. If the heart is weak, there is a risk of dying suddenly due to a dangerous irregular heart rhythm. Now let's talk about the prevention of heart failure. One way to prevent heart failure is to treat and control the conditions that can cause it. These conditions include coronary artery disease, high blood pressure, diabetes, and obesity. Some of the same lifestyle changes used to manage heart failure also may help prevent it. Try these heart healthy options. Tips: don't number 1, don't smoke. Number 2, get plenty of exercise. Number 3, eat healthy foods. Number 4, maintain a healthy weight. Number 5, reduce and manage stress. Number 6, take medicines as directed. So now let's talk about the how to diagnose the disease and how to have a treatment of heart failure. Diagnosis: to diagnose heart failure, your healthcare provider examines you and asks questions about your symptoms and medical history. Your provider checks to see if you have risk factors for heart failure such as high blood pressure, coronary artery disease, or diabetes. Your care provider listens to your lungs and heart with a device called a stethoscope. A whooshing sound called a murmur may be heard when listening to your heart. Your provider may look at the veins in your neck and check for swelling in your legs and belly. Test. Tests that may be done to diagnose heart failure may include blood test, X-ray, ECG or EKG or electrocardiogram, echocardiogram, ejection fraction, exercise test or a stress test, CT scan of the heart, heart MRI also called cardiac MRI, coronary angiogram, myocardial biopsy. So let's talk about in detail about the processes you can do to understand your heart failure. Tests that may be done to diagnose heart failure may include blood test. Blood test can help diagnose diseases that can affect the heart. Blood test also can look for a specific protein made by the heart and blood vessels. In heart failure, the levels of the protein goes up. Chest X-ray. Uh, X-ray X-ray images can show the condition of the lungs and heart. Electrocardiogram or ECG or EKG. This quick and painless test records the electrical signals in the heart. It can show how fast or how slowly the heart is beating. Echocardiogram. Sound waves create images of the beating heart. This test shows the size and structure of the heart and heart valves and blood flow through the heart. Ejection fraction. Ejection fraction is a measurement of the percentage of blood leaving your heart each time it is squeezes. This measurement is taken during an echocardiogram. This result helps classify heart failure and guides treatment. An ejection fraction of 50% or higher is considered ideal, but you can still have heart failure even if the number is considered ideal. Exercise test or stress test. These tests often involve walking on a treadmill or riding a stationary bike while the heart is monitored. Exercise tests can show how the heart responds to physical activity. If you can't exercise, you might be given medicines. CT scan of the heart, also called a cardiac CT scan. This test uses X-rays to create cross-sectional images of the heart. Heart MRI scan, also called a cardiac MRI. This test uses magnetic fields and radio waves to create detailed images of the heart. Coronary angiogram. This test helps spot blockers in the heart arteries. The healthcare provider inserts a long, thin flexual tube called a catheter into a blood vessel, usually in the groin or wrist. It's then guided to the heart. Dye flows through the catheter through arteries in the heart. The dye helps the arteries show up more clearly on X-ray images and video. Myocardial biopsy. In this test, a healthcare provider removes very small pieces of the heart muscle for examination. This test may be done to diagnose certain types of heart muscle diseases that cause heart failure. During or after testing for heart failure, your healthcare provider may tell you the stage of the disease. Staging helps determine the most appropriate treatment. There are two main ways to determine the stage of heart failure: New York Heart Association or NYSA classification. This system groups heart failure into four categories by number. You may see Roman numerals used for these category names. Class 1 heart failure. There are no heart failure symptoms. Class 2 heart failure. Everyday activities can be done without difficulty, but exertion causes shortness of breath or fatigue. Class 3 heart failure. It's difficult to complete everyday activities. Class 4 heart failure. Shortness of breath occurs even at rest. This category includes the most severe heart disease. Now, number 2, American College of Cardiology, ACC, or American Heart Association classification, AHA classification. This stage-based classification system uses the letters A to D. It includes a category for people who are at risk of developing heart problems, heart failure. Stage A, there are several risk factors for heart failure, but no signs or symptoms. Stage B, there is a disease, heart disease, but no signs or symptoms of heart failure. Stage C, there is heart disease and signs of symptoms of heart failure. Stage D, advanced heart failure requires specialized treatments. Healthcare providers often use the classification systems together to help decide the most appropriate treatment options. Your provider can help you interpret your stage. Care at Mayo Clinic. Our caring team of Mayo Clinic experts can help you with your heart failure related health problems. Now let's talk about treatment. Treatment of heart failure may depend on the cause. Treatment often includes lifestyle changes and medicines. If another health condition is causing the heart to fail, treating it may reverse heart failure. Some people with heart failure need surgery to open blocked arteries or to place a device to help the heart work better. With treatment, symptoms of heart failure may improve. Medications. A combination of medicines may be used to treat heart failure. The specific medicines used to depend on the cause of heart failure and the symptoms. Medicines to treat heart failure include angiotensin converting enzyme inhibitors or ACE inhibitors. These drugs relax blood vessels to lower blood pressure, improve blood flow, and decrease the strain on the heart. Examples include enalapril or lisinopril and captopril. Angiotensin 2 receptor blockers or ARBs. These drugs have many of the same benefits as ACE inhibitors. They may be an option for people who can't tolerate ACE inhibitors. They include losartan, valsartan, and candesartan. Angiotensin receptor plus neprilysin inhibitors or ARNIs. This medicine uses two blood pressure drugs to treat heart failure. The combination medicine is sacubitril, valsartan, or Entresto or Sabitar. It's used to treat some people with heart failure with reduced ejection fraction. It may help prevent the need for a hospital stay in those people. Beta blockers. These medicines slow the heart rate. And lower blood pressure. They reduce the symptoms of heart failure and help the heart work better. If you have heart failure, beta blockers may help you live longer. Examples include carvedilol, metoprolol, and bisoprolol. Diuretics, often called water pills, these medicines make you urinate more frequently. This helps prevent blood fluid buildup in your body. Diuretics such as furosemide also decrease fluid in the lungs, so it's easier to breathe. Some diuretics make the body lose potassium and magnesium. Your healthcare provider may recommend supplements to treat this. If you are taking a diuretic, you may have regular blood tests to check your potassium and magnesium levels. Potassium sparing diuretics, also called aldosterone antagonist. These drugs include spironolactone and eplerenone. They may help people with severe heart failure with reduced ejection fraction live longer. Unlike some other diuretics, these medicines can raise the level of potassium in the blood to dangerous levels. Talk to your healthcare provider about your diet and potassium intake. Sodium glucose transporter 2 inhibitors or SGLT2 inhibitors. These medicines help lower blood sugar. They are often prescribed with diet and exercise to treat type 2 diabetes. But they are also one of the first treatments for heart failure. That's because several studies showed that the medicine lowered the risks of hospital stays and death in people with certain types of heart failure. Even if they didn't have diabetes, these medicines include canagliflozin and dapagliflozin and empagliflozin. Next, digoxin. This drug, also called digitalis, helps the heart squeeze better to pump blood. It also tends to slow the heartbeat. Digoxin reduces heart failure symptoms in people with heart failure with reduced ejection fraction. It may be more likely to be given to someone with a heart rhythm problem called such as atrial fibrillation. Hydralazine and isosorbide dinitrate (BDIL). This drug combination helps relax blood vessels. It may be added to your treatment plan if you have severe heart failure symptoms and ACE inhibitors or beta blockers have not helped. Vericiguat. This medicine for chronic heart failure is taken once a day by mouth. It's a type of drug called an oral soluble guanylate cyclase (SGC) stimulator. In studies, people with high risk heart failure who took this medicine had fewer hospital stays for heart failure and heart disease related deaths compared to with those who got a dummy pill. Positive inotropes. These medicines may be given by IV, they mean intravenous, through your veins to people with certain types of severe heart failure who are in the hospital. Positive inotropes can help the heart pump blood better and maintain blood pressure. Long-term use of these medicines has been linked to an increased risk of death in some people. Talk to your healthcare provider about the benefits and risks of these drugs. Other medicines. Your healthcare provider may prescribe other medicines to treat specific symptoms. For example, some people may receive nitrates for chest pain, statins to lower cholesterol, or blood thinners to help prevent blood clots. Your your healthcare provider may need to change your medicine doses frequently. This is more common when you have just started new medicine or when your condition is getting worse. You may be admitted to the hospital if you have a flare of heart failure symptoms. While in the hospital, you may receive medicines to relieve your symptoms, more medicines to help your heart pump better, oxygen through a mask or a small tubes placed in your nose. If you have severe heart failure, you may need to use supplemental oxygen for a long time. Surgery or other procedures. Surgery or other treatment to place a heart device may be recommended to treat the problem that led to heart failure. Surgery or other procedures for heart failure may include coronary bypass surgery. You may need this surgery if severely blocked arteries are causing your heart failure. The surgery involves taking a healthy blood vessels from the leg, arm, chest and connecting it below and above the blocked artery in the heart. The new pathway improves blood flow to the heart muscle. Heart valve repair or replacement. If a damaged heart valve causes heart failure, your provider may recommend repairing or replacing the valve. There are many different types of heart valve repair. The type needed depends on the cause of the heart valve problem. Heart valve repair or replacement may be done as open heart or minimally invasive surgery. Implantable cardioverter defibrillator or ICD. An ICD is used to prevent complications of heart failure. It isn't a treatment for heart failure itself. An ICD is a device similar to a pacemaker. It's implanted under the skin in the chest with wires leading through the veins and into the heart. The ICD monitors the heartbeat. If the heart starts beating at a dangerous rhythm, the ICD tries to correct the beat. If the heart stops, the device shocks it back into regular rhythm. An ICD can also work as a pacemaker and speed up a slow heartbeat. Cardiac resynchronization therapy or CRT, also called biventricular pacing. CRT is a treatment for heart failure in people whose lower heart chambers aren't pumping in sync with each other. A device sends electrical signals to the lower heart chambers. The signals tell the chambers to squeeze in a more coordinated way. This improves the pumping of blood out of the heart. CRT may be used with an ICD, ventricular assist device or VAD. A VAD helps pump blood from the lower chambers of the heart to the rest of the body. It's also called a mechanical circulatory support device. Although a VAD, a ventricular assist device, can be placed in one or both lower heart chambers of the heart, it's usually placed in the lower left one. Your healthcare provider may recommend a VAD if you are waiting for a heart transplant. Sometimes a VAD is used as a permanent treatment for people who have heart failure but who aren't good candidates for a heart transplant. Last option is heart transplant. Some people have such severe heart failure that surgery or medicines don't help. These people may need to have their hearts replaced with a healthy donor heart. A heart transplant isn't the right treatment for everyone. A team of healthcare providers at a transplant center helps determine whether the procedure may be safe and beneficial for you. Lastly, symptom care and end of life care. Your healthcare provider may recommend special medical care to reduce symptoms and improve quality of life. This is called palliative care. Anyone who has a serious or life-threatening illness can benefit from this type of care. It can be used to treat symptoms of the disease or to ease the side effects of treatment. In some people with heart failure, medicines no longer work and a heart transplant or device isn't an option. If this occurs, a special end-of-life care may be recommended. This is called hospice care. Hospice care allows family and friends, with the aid of nurses, social workers, and trained volunteers, to care for and comfort a loved one. Hospice care is available in your home or in nursing homes and assisted living centers. Hospice care provides the following for those who are sick and their loved ones: emotional support, psychological support, and spiritual support. Although it can be difficult, discussing end of life issues with your family and medical team is important. Part of the discussion will likely involve an advanced care directive. This is a general term for spoken and written instructions you give concerning your medical care should you become unable to speak for yourself. If you have an ICD, one important consideration to discuss with your family and healthcare team is whether the ICD should be turned off so that it can't deliver shocks to make your heart continue beating. So that's all. Now you can get the latest heart transplant related health information from Mayo Clinic. The center is Arizona, Florida, Minnesota. Critical trials clinical trials. Explore Mayo Clinic studies, testing new treatments, interventions, and tests as means to prevent, detect, treat, or manage this condition. Lifestyle and home remedies. Some people with heart failure may be told to take omega 3 fatty acid supplements. Some research shows that the supplements may help reduce the need for hospital stays. Making certain lifestyle changes often improve heart failure symptoms. They may even stop the condition from getting worse. The following changes are recommended to improve heart health. Number one, don't smoke. Smoking damages the blood vessels and raises blood pressure. It lowers blood oxygen levels and speeds up the heartbeat. Quitting is the best way to reduce the risk of heart problems. If you need help quitting, talk to your provider. You can't be considered for a heart transplant if you continue to smoke. Also, avoid secondhand smoke. Check your legs, ankles, feet for swelling. Do this every day. Call your healthcare provider if the swelling worsens. Weigh yourself. Ask your healthcare provider how often you should do this. Weight gain may mean your body is holding onto fluid. You may need a change in treatment. Call your provider if you gain 5 pounds or 2.3 kilograms or more within a few days. Manage weight. Being overweight increases the risk of heart problems. Ask your healthcare provider what weight is best for you. Even losing a small amount of weight can help improve heart health. Eat a healthy diet. Aim to eat a diet that includes fruits and vegetables, whole grains, fat-free or low-fat dairy products, and lean proteins. Limit saturated or trans fats. Limit salt. Too much salt, also called sodium, can make the body hold on to water. This is called water retention. It makes the heart work harder. Symptoms include shortness of breath and swollen legs, ankles, and feet. Ask your healthcare provider if you should follow a no salt or no salt diet. That salt is already added to prepared foods. Limit alcohol. Alcohol can interfere with certain medicines. It also weakens the heart and increases the risk of irregular heartbeats. If you have heart failure, your healthcare provider may recommend that you don't drink alcohol. Ask how much fluids you can drink. If you have severe heart failure, your provider may suggest that you limit the amount of fluids you drink. Stay as active as possible. Moderate exercise helps keep the heart and body healthy, but be sure to talk to your healthcare provider about an exercise program that's right for you. If you have heart failure, your provider may suggest a walking program or a cardiac rehabilitation program at your local hospital. Reduce stress. Strong emotions such as anxiety or anger can make the heart beat faster. Breathing becomes heavier and blood pressure goes up. These changes can make the heart failure worse. Find ways to reduce emotional stress. Practicing mindfulness and connecting with others in support groups are some ways to reduce and manage stress. Get better sleep. Heart failure can cause shortness of breath, especially when lying down. Try sleeping with your head propped up, using a pillow or a vest if you snore or have had other sleep problems. Make sure you get tested for sleep apnea. Get recommended vaccinations. Ask your healthcare provider about getting influenza, pneumonia, and COVID-19 vaccinations. Now let's talk about coping and support. Managing heart failure requires open communication between you and your healthcare provider. Be honest about any challenges concerning your diet, lifestyle, and medicine use. Pay attention to your body and how you feel. Tell your provider when you are feeling better or worse. This helps your healthcare provider know that what treatment works best for you. These steps may help you manage heart failure. Take medicines as directed. If side effects or cause problems, ask your healthcare provider about other options. Don't stop taking your medicines without first talking to a care provider. Also, go to all scheduled health appointments. If you miss one, ask your healthcare provider how and when to reschedule. Use caution with other medicines and supplements. Some medicines available without a prescription to treat pain and swelling can make heart failure worse. They include ibuprofen and naproxen sodium. Some diet pills and supplements may also be unsafe if you take medicines for heart failure. Always tell your healthcare provider about all the medicines you take, including those bought without a prescription. Weigh yourself daily. Do this when you first wake up, after breakfast, and after peeing. Write your weight down in a notebook. Bring the notes to medical checkups. An increase in weight can be a sign of fluid buildup. Check your blood pressure at home. Write down your numbers and bring them with you to your health checkups. Doing so helps your care providers know if treatment is working or your condition is getting worse. Home blood pressure monitors are available at local stores and pharmacies. Know how to contact your healthcare provider. Keep your provider's phone number, the hospital's phone number, and directions to the hospital or clinic on hand. You will want easy access to this information if you have health questions or if you need to go to the hospital. It may help to ask your friends and family to help you meet your goals. Preparing for your appointment. If you are worried about your heart failure risks, make an appointment with your healthcare provider. You may be referred to a doctor trained in heart disease. This type of provider is called a cardiologist. If heart failure is found early, treatment may be easier and more effective. Appointments can be brief. Because there's often a lot to discuss, it's a good idea to be prepared for your appointment. Here's some information to help you get ready. What can you do? What you can do? Be aware of pre-appointment restrictions. When you make the appointment, ask if there's anything you need to do in advance, such as restrict your diet. You may need to avoid food and scented drinks before some test. Write down any symptoms you are having, including any that may seem unrelated to heart failure. Write down important personal information, including a family history of heart disease, a stroke, high blood pressure, or diabetes, or any major stresses or recent life changes. Find out if anyone in your family has had heart failure. Some heart conditions that cause heart failure run in families. Knowing as much as you can about family history can be helpful. Make a list of all medicines, vitamins, or supplements that you are taking. Include doses. Bring this list with you to all health checkups. Take a family member or friend along if possible. Sometimes it can be difficult to remember all the information given to you during an appointment. Someone who goes with you may remember something that you missed or forgot. Write down questions to ask your healthcare provider. For example, if you have heart failure, you might ask if it's safe for you and your partner to have sex. Most people with heart failure can continue having sex once symptoms are under control. If you have questions, talk to your healthcare provider. Your time with your provider is limited. So preparing a list of questions will help you make the most of your time together. List your questions from most important to least important in case time runs out. For heart failure, some basic questions to ask your healthcare provider include: what's the most likely cause of my symptoms? Are there other possible causes for my symptoms? What kinds of tests will I need? Do these tests require any special preparation? What treatments are available? Which do you recommend for me? What food should I eat or avoid? What's an appropriate level of physical activity? Do I have any activity restrictions? How often should I be screened for changes in my condition? I have other health conditions. How can I best manage these conditions together? Is there a generic available for the medicine you are prescribing for me? Do my family members need to be screened for conditions that may cause heart failure? What website do you recommend? Don't hesitate to ask other questions. What to expect from your doctor? Your healthcare provider is likely to ask many questions. Being ready to answer them may save time to go over any details you want to spend more time on. Your provider may ask, when did you first notice your symptoms? Do your symptoms occur all the time or do they come and go? How severe are your symptoms? What if anything, seems to improve your symptoms? Does anything make your symptoms worse? What can you do in the meantime? It's never too early to make healthy lifestyle changes, such as quitting smoking, cutting down on salt, and eating healthy foods. These changes can help prevent heart failure from starting or worsening. So that's all about, and you will also have some doctors and departments. Normally, the department is cardiology, and sometimes the department is cardiovascular medicine, cardiovascular surgery, children's center, critical care, heart failure clinic, heart transplant program, pediatric and adolescent medicine, pediatric cardiac surgery, pediatric cardiology, transplant center. So that's also, there are many. There is a list of some well-known, reputed doctors on cardiology and cardiac surgeon. So that's all about Mayo Clinic. From the beginning, I wanted to tell you that Mayo Clinic is one of the best, well-known and documented sources of so if you feel any uneasiness, if you feel any problem, you can you can uh, you can go to the website of Mayo Clinic, and I think if you have a good English level, you will understand a lot about this. So wishing you all a very good and sound health. Wishing you all a good heart, healthy lifestyle, healthy sleep, healthy diet. So wishing you all a goodbye, and once again wishing you, requesting you all to browse the videos in this channel. The videos in this channel are for education and entertainment purpose. If you like this, you can browse the videos and you can subscribe to these videos. Thank you very much. Bye bye. So thank you very much. So thank you very much for your patient hearing. So thank you very much for your patient hearing. Requesting you all to subscribe to this channel. Requesting you all to subscribe to this channel. Bye bye.